Self-sutures in extreme situations, leeches where they shouldn't be, and you know what I always say, don't pull it out. Today, we are breaking down and reacting to the healing, animations, and survival injuries from the stealth action video game Metal Gear Solid 3 Snake Eater.
Kept you waiting, huh?
Let's dive right in. Oh, just hearing the crunch, the sound that we sometimes hear at the hospital when we're putting bones back together, is actually pretty accurate.
Snake, you've got a broken bone. You'll suffer broken bones if you jump from too high a place or get hit with a severe blow.
That's pretty cool. This is actually pretty cool information.
I'm learning a lot from you right now.
Oh, what is this? Non-displaced rib fractures. You don't really want to put a bandage on rib fractures if there's no wound on the outside, because then it's going to prevent you from expanding your lungs. It increases the risk of developing pneumonia because you're splinting, not allowing normal airflow in and out of the lungs. What do we got here? Oh, we got a forearm injury.
Your arm is broken, you have a broken arm.
You got two bones of the forearm, your ulna and your radius. If your arm is in that position, that is your radius. There's something called the annular ligament where the head of the radius is, and it allows us to rotate like this. That's why we're able to rotate the forearm. What are we doing? Oh, trying to reset either a bone or a dislocated joint. From an elbow standpoint, most commonly you're going to have a posterior dislocation of your olecranon or the ulna, basically going backwards. Really not easy to just pull it and put it back into place.
That's a nasty cut you've got there. To treat a cut, you need disinfectant, styptic, sutures, and a bandage.
Disinfect the wound, yeah, so clean the wound. Styptic, which is basically a vasoconstrictor to stop any active bleeding, sew it up, and bandage. So we don't do the styptic unless we want to anesthetize the area and we inject lidocaine with epinephrine. The epinephrine causes vasoconstriction to slow down the bleeding, actually. Oh, wow. Sewing up the wound. We got Rambo style, sewing up the wound without any anesthesia.
Rambo style.
It's a little crude. We're biting off the thread. When you're actually suturing a wound closed, it's a clean procedure. It's not necessarily a sterile procedure. Blast injury. Whoa, on fire.
Snake, you've got a bad burn.
That is a very bad burn. Probably going to be full thickness, 3rd degree burn. Even the airway is going to probably have some injuries to it. Doesn't realistically portray what a burn will do to your body here. Oh. Holy cow. These are not survivable injuries. Come on.
Come on!
People will get multiple gunshot wounds and will survive, or somebody has gotten one gunshot wound and passed away. We're going to first do our resuscitation. Airway, breathing, circulation. Then we're going to look specifically at the holes. Get imaging, see if you need to take the person to the operating room to fix the underlying structures that have been destroyed because of the path of the bullet.
To treat a gunshot wound, you need to dig out the bullet with your knife, disinfect the wound, and apply styptic, and wrap it in a bandage.
If the bullet is close to the surface and you can literally feel it right there, fine, you can try to get it out. But in general, digging around with a knife is going to cause more damage. Areas of the body that we do want to get the bullets out of would be joints, maybe brain, and probably the spinal cord. But everywhere else, if it's in your soft tissue, it's left.
Snake, look at your body.
Yep, looking good.
Not there.
Then where?
See the leeches?
Oh, cool. Leeches, when they bite, they actually produce an anticoagulant so they can prevent your blood from clotting where the hole is that they're sucking out of, basically. What are all these leeches just buried in? That's so funny. Sometimes in medicine, they'll actually use leeches. A couple of different reasons, depending on where you are in the world. Sometimes for bloodletting, other times for trying to actually draw blood to a certain area. Smoke that cigar. Oh my gosh. What a waste of a good cigar. Don't smoke cigars. Increases your risk for mouth cancer. Oh, so you have your cigar to burn them off? Come on.
Come on!
Oh, Is that crossbows? What do I always say? Don't pull it out. Say it's in your bone or your muscle. You're trying to contract and it's preventing that from happening. But these have barbs on the end of them, making it very difficult for you to pull them out. They're pretty much stuck. Yep.
That bolt is coated in the venom of the Brazilian wandering spider.
Brazilian wandering spider, one of the most venomous spiders in the world. It causes significant amount of pain, sweating. It can even cause priapism, the sustained, unwanted, non-sexual aroused erections.
You can get serum by capturing the rabbits that live in that area. The rabbits in that area have antibodies that protect them against the venom of the Brazilian wandering spider.
Anti-venom is basically from serum of different animals that have been able to produce the antibodies against the venom. Here in the United States, the anti-venom that we have is basically against certain snakes. We have two different types of anti-venom, one made via horse and the other made via goat.
It'll all be goat.
Then disinfect the wound and apply styptic to stop the flow of blood. Once that's all done, the arrow wound should heal right up.
These are not just gonna heal right up. We have penetrated trauma to the thoracic cavity, likely punctured the lung, probably causing a hemopneumothorax. There's a potential that it actually hit the heart. Oy! On the lower extremity there, just medial to the femur, there's a chance that you can hit the femoral artery, just depending on your body of where it crosses. Even in the one in the neck. The one in the neck, you can't tell if it's going through the spine or not. Watching Snake patch himself up in the middle of the jungle honestly reminds me that staying calm is definitely a skill. And that's why actually I created Chillax by my company Life Happens, designed to support relaxation and help take the edge off when life gets a little intense. Check out Chillax at lifehappens.com or on Amazon. Oof.
Snake, your right eye.
Trauma to the right eye. You can get traumatic iritis. You can cause a laceration around the eye. You can actually rupture the eye called a globe rupture where the fluid of the eye starts coming out. You can also cause any type of fracture around the eye socket.
The cornea and the lens are severely damaged and the eyeball is ruptured.
There we go.
There you are!
The cornea are the cells that are covering the color part of our eye. Very sensitive. The lens is behind the color part of our eye and allows light and images to be reflected onto the retina in the back. Crazy. So Metal Gear Solid healing animations. These are pretty cool, pretty intense, and there's like medical components to it. If you guys enjoyed this and there's more animations in this type of game, please let me know in the comments. Let me know what animations you think I should definitely check out next. Check out this playlist right here to binge watch everything, and make sure that you subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.